It's hard to imagine that this spunky little 4-year-old
Blanket?
Oh, I'm good, thank you.
is just one of many critically ill children in the state of Kansas.
She has congenital central hypoventilation syndrome.
In other words, Nora's brain doesn't tell her body when and how to breathe.
So this is what we wake up to in the middle of the night.
Mama, 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 mama.
When you are told that your kid has a genetic disorder, that means lifelong.
The care Nora requires is exhausting. Clearing trach tubes, maintaining medical devices, checking oxygen levels. When Nora's breathing changes, the machines have to be adjusted. 24 hours a day, 7 days a week. It's the norm for Corey Calvert, Nora's mom.
Some days it's almost impossible, and we wake up anywhere from 7 to 15 times a night.
There are more than 500 children in Kansas the state considers critically ill. Their parents' lifeline to sanity? In-home skilled nursing.
And what we have to do is prevent that caregiver burnout.
Medicaid pays for and provides nurses for this special subset of children, since private insurance companies won't fit the bill. Lynn Dalrymple of Thrive Pediatric Care in Wichita says there's a hitch.
The Medicaid reimbursement is so low that gap makes it that we can't pay a nurse a competitive wage to get them in the home to take care of these children.
Take a look at the pay gaps. In the ER, you can bring in around $65,000 a year in Kansas. Nursing homes, a bit less. But Medicaid-funded home health nurses, less than $40,000.
It's just difficult to get a good nurse to say, okay, sure, I'll take a 25, 30, whatever it is, % pay cut.
This difference in pay creates a shortage, a problem so extensive, some children have to stay in the hospital.
2 in the hospital right now that are waiting to come home from Children's Mercy, and we just don't have the care.
It's up to the individual states to increase pay for nurses. Senator Gene Suellentrop, chair of the Committee on KAKE Oversight, says that's difficult. He joined us by phone to explain.
It's always about the money. Is there enough? Who gets it? Where does it go? What are we accomplishing with it? If we look at surrounding states, perhaps we are at or near some of the lower ends of those levels, and it's truly unfortunate.
Little consolation to a family just trying to survive.
The nursing situation is just rough, and as a parent, you feel so helpless. Like, we need this, but we can't get it. Yeah, this is just one more battle we have to fight.
And she's certainly going to fight. On Monday, Calvert is going to stand in front of Senator Suellentrop and the entire KAKE Oversight Committee to plead the case for additional pay for nurses in Topeka. We'll cover the progress and keep you in the loop. In the studio, Pilar Pedraza, KAKE News investigates.